What you didn't know about schizophrenia. Schizophrenia is a mental health condition that people are willing to talk about these days. The condition is characterized by disordered thoughts, unusual speech and behavior, and an inaccurate view of reality. It's often used as the go-to disorder for violent criminals in movies and television shows, but in reality, schizophrenia affects a diverse range of people, many of whom are able to lead a normal, satisfying life with the help of treatments like therapy and medication. From symptoms to possible causes, people with schizophrenia are among the most stigmatized and socially marginalized in our community. Part of the problem is that it's a commonly misunderstood disorder. There are many things that people believe about schizophrenia that are simply not true or are distortions and exaggerations. Adding to the isolation and loneliness is the way some families or even communities see mental illness as a taboo subject. Among some groups, a mental illness like schizophrenia can be perceived as a source of shame, embarrassment, or something that will cause a loss of face. Beliefs like these are harmful. The stigma of being singled out for having schizophrenia can lead to severe social isolation. This in turn can lead to further mental health and even physical health problems. Despite what people believe, schizophrenia is like many other mental disorders. It can be managed and there are recognized treatments. Here's what you actually need to know about schizophrenia. Before we continue, make sure you hit the like button, subscribe to our channel, and activate the notification bell to receive your daily dose of knowledge. 1. Schizophrenia literally means split mind. The name schizophrenia comes from the Greek words schizein, to split, and phren, mind. Swiss 1. Schizophrenia literally means split mind. The name schizophrenia comes from the Greek words schizein, to split, and phren, mind. Swiss psychiatrist Paul Eugen Bleuler came up with the word in 1910 for the disassociation of various mental functions he saw in his patients. Before the term schizophrenia was coined, patients who exhibited symptoms of the condition were thought to have something called dementia praecox, or dementia of early life. When Bleuler observed that the disease didn't necessarily lead to mental deterioration and patients were even capable of improving, he realized dementia wasn't the problem. 2. Schizophrenia has nothing to do with split personalities. Schizophrenia is not the same thing as dissociative identity disorder, which was previously known as multiple personality disorder. Someone can be diagnosed with dissociative identity disorder if they alternate between two or more identities, each with their own distinct traits. Schizophrenia, on the other hand, is characterized by auditory and visual hallucinations, amnesia, and general perceptions of reality, none of which have anything to do with changing personalities. The associations with split personalities is one of the biggest misconceptions attached to schizophrenia. 3. There are positive and negative symptoms of schizophrenia. Positive symptoms of schizophrenia include delusions, hallucinations, and catatonia, which is when a person stays in a single position for a very long period of time. Negative symptoms are defined as the absence of normal behaviors. This includes reduced speech and energy, lack of motivation, lack of emotion, and withdrawal from family and friends. And there are cognitive symptoms and have to do with memory and thinking. They include problems understanding information and using it to make decisions, a hard time concentrating, trouble with working memory, being able to use information right after learning it. 4. Experts aren't totally sure what causes schizophrenia, but it's thought to be a combination of factors such as genes and brain chemistry. People often point solely to factors like family dynamics as the origin of schizophrenia. Ananda Paradangi, PhD, director of the Schizophrenia and Electroconvulsive Therapy programs at Virginia Commonwealth University's Department of Psychiatry, tells Self, "This is totally inaccurate." And Durangi says, according to the NIMH, the condition is largely genetic. Multiple genes might increase a person's risk of developing schizophrenia. An imbalance in neurotransmitters such as dopamine and glutamate might also make a person more susceptible to this mental health condition. In addition, people with schizophrenia experience brain changes such as reduced gray matter. Gray matter is the brain tissue that helps with processing information according to the National Institute of Neurological Disorders and Stroke. Experts are still investigating to what extent this decrease in gray matter is involved with schizophrenia's onset and trajectory. Finally, components like mind-altering drug use as a teenager or young adult, prenatal exposure to viruses that can affect brain development, prenatal malnutrition, and psychosocial factors, meaning psychological and social issues such as childhood trauma, can also play a role. The takeaway: no single environmental or behavioral factor leads to schizophrenia. 5. The first signs of schizophrenia usually appear in adolescence. Most people with schizophrenia develop it fairly early in life. The most common time of symptoms to appear is in late adolescence or early adulthood. While male patients typically start dealing with schizophrenia in their late teens or early 20s, women tend to develop it a bit later in their late 20s and early 30s. The brain goes through crucial changes in late adolescence, which could make it especially vulnerable to psychotic disorders like schizophrenia.